In Touch is a public affairs presentation of Broadcast Communications, Inc.
I'm Eric O'Brien, keeping you in touch with the community. Today on In Touch, this month of November has been Lung Cancer Awareness Month. Of course, we all know the dangers of smoking and what it does to the lungs, but there are other ways in which you can contract lung cancer. With me on the line today is Dr. Michael Szwerc. He is the thoracic surgeon and director of the Advanced Lung Center at Excella Health. Dr. Szwerc, welcome to In Touch.
Eric, thank you for having me today. It's a pleasure.
First of all,
I look forward to talking to you.
Absolutely. We're happy to have you. First of all, tell us a little bit about what you do as, number one, a thoracic surgeon, and number two, the director of the Advanced Lung Center at Excella Health.
Thoracic surgery involves surgical treatment of diseases of the chest cavity. So we're actively involved in the management of all diseases of the lungs, the heart, and the esophagus. I came to Excella at the end of 2014, and what was identified at the time was a need for developing a center to manage the high volume of pulmonary-related diseases out here and lung cancer. And so we put together a comprehensive program that involves outpatient facilities, inpatient care, and brought to Western Pennsylvania some of the latest in technological advances in lung cancer management and in surgery of the chest. We do a lot of robotic surgery here as well.
I see. Now, how long ago was that? You came in 2014, the end of 14, and the center has been around since then, or was it there before you?
There has always been physicians that did thoracic surgery in hospitals in Western Pennsylvania. There are big centers in Pittsburgh and downtown, but there hasn't been any comprehensive program. And so some of these smaller community hospitals would have physicians that did procedures. But what we really needed to build out here, because there's such a density of people that have emphysema, COPD, and tobacco abuse and industrial exposure, is to build a comprehensive center for management of the diseases. And often that involves, building inpatient capacity to take care of them, outpatient facilities to evaluate and manage them, and the technical expertise to offer invasive procedures. So it's a multifaceted approach, and we've now done it here for 5 years, and we're seeing over 4,000 people a year in our centers.
Oh wow, that's amazing. And we know that lung cancer is often caused by smoking, but there are other ways in which it can be contracted, environmental issues and so on. Tell us what some of those circumstances are, if you will.
Well, several weeks ago, I gave a presentation at a national meeting looking at lung cancer detection and lung cancer screening. And this was a meeting of thoracic surgeons from all over the country. And we brought our data from Excella Health to the meeting and talked about our screening programs. And the thing that struck me as really significant is that the percentages, the national average of detecting lung cancer in a program may be 1.5%, but our numbers are higher than that out here. And while the only criteria that we use nationally for detection is a history of smoking and a certain age profile, and I'll give you those numbers, patients between the ages of 55 and 77 who have smoked 30-pack equivalent of tobacco a year, that means a pack a day for 30 years, and who are current smokers or former smokers who quit no longer than 15 years ago are eligible for screening. And screening defines an annual low-dose CAT scan performed at one of our centers. Now, these are the criteria that have been set aside as being highly predictive of finding people with lung cancer. But what we find in Western Pennsylvania is there's a lot of people that have worked in glass factories, that have worked in foundries, that grew up near coke ovens, that worked in coal mines and steel foundries, who were never smokers but developed significant lung disease and lung cancer. I've seen many people from the Mount Pleasant and Jeannette areas who have never smoked, who are in their 9th decade of life, who are female, who have developed lung cancer.
Mm-hmm.
And a lot of them worked in glass factories.
Ah.
And so we have an outreach program here that's really targeting smokers in a certain age group, but we're inviting all people to be evaluated to make sure that they don't have lung cancer.
Okay. And we're talking about how the factories, the glass factories, and I know on a personal note, I knew somebody who contracted lung cancer from living not too far from the steel mills growing up here in Allegheny County, and it came as a shock because this person never smoked a day in her life, and developed what kind of cancer would that be in particular?
Well, it's interesting. When I first began my career 20 years ago, it was very unusual to find a never smoker develop lung cancer.
Right.
And over the time, what we've seen is a higher percentage of never smokers, especially women, developing lung cancer. We've seen here in the last couple of years women as old as 30 years old developing advanced lung cancer who were never smokers.
Mm-hmm.
What kind they have, there are two main types of lung cancer. One is called small cell and one is called non-small cell. And the distinction is just simply what the tumor looks like when you analyze it under a microscope. But the prognosis and the treatment is entirely different. The vast majority of people that develop lung cancer develop what's called non-small cell lung cancer. And this is really the focus of detection programs, finding these tumors at a very early and a very curable stage. Mm-hmm. Unfortunately, most people who develop lung cancer, they figure it out when they have symptoms. And when patients have symptoms, it's often advanced stage and very hard to cure. And so the goal here from a national and an international level is to find early stage lung cancer. Lung cancer is the number one cancer killer.
Okay.
And it causes more deaths than colon cancer, prostate cancer, and breast cancer combined per year.
And is this more a recent trend in the different kinds of lung cancer you've been seeing? As you mentioned, most of these non-smoker acquired cancers, or has this always been the case?
Well, I think what's become more common in the United States and worldwide is the use of CAT scanning. So in the old days, people would get chest X-rays, and chest X-rays are very insensitive to identify tumors and should not be used as a screening device. Now that we're getting more and more CAT scans, patients go into the emergency room and they have an issue and they get a CAT scan, or they're in a car accident and they get a CAT scan for trauma purposes. We're finding tumors at an earlier stage. So I think what we're seeing is more detection. And I think in part of finding more detection is finding other people that are getting these things that we didn't see before. And so that's why we're seeing more never smokers. The bottom line, though, is 85% of people that develop lung cancer have a history of smoking or are active smokers. And our real efforts in the United States and worldwide should be targeted towards smoking cessation programs and smoking prevention programs.
And of course, nowadays we add to the list of smoking paraphernalia, as it were, vaping, which is not only harmful to the lungs, but other parts of the body as well, as we're finding out. But how did that come to be, and how can we stop that? How can we back off of that notion?
Vaping is a big concern. It's a big concern nationally. It's a big concern out here in Western Pennsylvania. A lot of people think that vaping is less harmful than traditional smoking. and that tobacco smoke gives people exposure to more than 7,000 chemicals. What we don't know is the chemical composition in some of the vaping products. What we do know, though, is that the nicotine in vaping, which is poorly understood by a lot of the younger kids that are vaping, a lot of them don't even realize there's nicotine in there. The levels of nicotine in vaping may be higher than average cigarettes and lead to a high addiction and dependency on nicotine at an early age.
Mm.
And nicotine can be as addictive as cocaine and heroin.
Sure.
One of the things that people come to us for and say, is this safer than tobacco smoke? In reality, it is probably safer, but the harmful effects of nicotine dependence are astronomical. And we have to do everything we can to prevent that, especially in teens and especially in middle school and high school people. Unfortunately, the companies that make these products have often targeted children, adolescents through social media and other ways. And actually, as of yesterday, the American Medical Association called for a total ban on all vaping products that are not FDA approved.
Wow.
To date, as of November of this year, over 2,000 serious lung illnesses and over 40 deaths directly related to vaping have occurred in the United States.
Mm.
And in fact, attorney general offices in the states of New York, North Carolina, and California have announced lawsuits against the makers of vaping products, specifically Juul Labs, for illegally marketing flavored cigarettes to teenagers.
Wow. And it was all too late, regardless of how soon they backtracked on that. It was probably too late for those people who have whose lives have been ruined by that.
It is amazing what you see and what you hear. There are pods attached to these vaping products. Students in high schools and colleges talk about these little pods literally covering the floors outside of doors and entryways to their dormitories. Mm. And kids are getting addicted at a high age. I can give you a personal example. As I was going to a meeting and I stopped at a convenience store, and one of the workers from the convenience store was sitting on the curb outside where people park their cars. And in one hand, she had a tobacco cigarette. In the other hand, she had a vaping product. And she was alternating smoking and vaping at the same time.
Wow.
How highly addictive this is. There has to be a national push to stop the unchecked use of these products in youth. We don't need to get another generation addicted to tobacco just for profit and tax reasons.
Right. How are we doing with that fight in general? I mean, when I was growing up, there was all kinds of ad campaigns and so on, stop smoking, don't smoke, don't even start, don't even think about it. It was one time kind of a status thing, and it became, we became more aware as time went on, and it seems like we take a step forward and 2 steps back with the vaping coming into play.
Well, I think there are 2 issues. Unfortunately, if you look at Juul, which is now the market leader in the sale of vaping products, the U.S. sales alone in the last quarter were over $150 million.
Wow.
The company is valued at $38 billion and had revenue of $2 billion in sales in 2018. Who owns a 35% stake in the company? It's a group called Altria. And what was Altria? Altria was formerly Philip Morris, who makes Marlboro cigarettes.
Right.
And so these companies are using all the technology and the innovation and marketing behind promoting tobacco for all those years, and now switching to a new product and using the same playbook to get people addicted again. The price we pay for making money and harming children is unfortunately lost in this equation. That's why we have to have a grassroots effort to ban this thing. We're getting smarter, but it's too late in some ways. We're increasing the age at which you can buy these things to 21. We're eliminating the flavors that are put into these things that are attractive to young kids. Some of the flavors include cotton candy, watermelon, apple pie, and all these things are targeting kids.
Yeah. It's like getting your teeth cleaned with the different flavors of toothpaste, but far worse than that. Absolutely.
Yeah, and what they say is that the addictive power of nicotine is harder in kids.
Mm-hmm.
It's worse in kids' bathrooms in schools they call vape rooms, and kids are going in there and doing this in between class. And so it's really sad. It's really sad. And I do think that on one end, our center here deals with the ravages of cancer, the ravages of long-standing tobacco abuse in the elderly population. And now what really bothers many of us who do this for a living is seeing, healthy 10 and 15-year-old kids getting started in this again.
Yeah.
And that we haven't become smarter as a society to ban this. And the question is, why are we so interested in having vaping shops all over the place? And I can't help but think the tax revenue is one of the reasons, and that's an unfortunate reality of how we function in a society.
Indeed it is.
That we're willing to expose kids to an addictive process just for profit.
Right.
And that's terrible.
You're listening to In Touch. I'm Eric O'Brien. My guest today is Dr. Michael Szwerc. He is a thoracic surgeon and director of the Advanced Lung Center at Excella Health. We're talking about Lung Cancer Awareness Month, which has gone on through the month of November. Dr. Szwerc, you talked earlier about symptoms of lung cancer, and if you start feeling the symptoms, it's well advanced by that point. What are those symptoms that one might feel if they suspect lung cancer?
One of the things that patients will come to their primary care physician complaining of is a persistent cough. A cough that's initially felt to be bronchitis or some inflammation that doesn't go away. That's usually one of the signs that you have a tumor that's fairly central in the chest cavity that is irritating the airway and causing cough. Coughing up blood, we call it hemoptysis, is very concerning. A patient that ever coughs up blood has to seek attention immediately. Weight loss, chest pain, fatigue, and those are usually signs of cancer that's progressing, and shortness of breath. So I think that the two hallmark signs in patients to look for: a cough that needs to be explained and shortness of breath that needs to be explained.
Mm.
And I think that's where our primary care doctors do a nice job at listening to the patients, taking a thorough history, physical, understanding their smoking story, and then getting the appropriate tests quickly to rule in or rule out the presence of lung cancer.
Now, where are the Advanced Lung Center locations? You have more than one at Excella, don't you?
We do. We have we see patients at the Arnold Palmer Mountain View Clinic, which is a joint venture with the University of Pittsburgh and the Hillman Institute. Out here, we have outpatient radiation oncology, we have chemotherapy, we have full diagnostic studies, including CAT scans here, and this is where a lot of our patients come. We also do screening down at Frick, at the Frick Hospital, and we do it at the Norwin Square, which is an outpatient facility in Norwin.
Mm-hmm.
And we also do lung cancer screening at Latrobe Square, which is our newest outpatient facility in Unity Township off of Route 30.
And one of those screenings is a low-dose CT scan, which explain that process to us. What does low-dose mean? And I mean, everybody's had a CT scan at least once in their life, but what does low dose mean?
When you have a CAT scan, there's so many different ways to do it, depending on what question you are asking and what part of the body you want to see. Patients can get an IV and they can get dye in their veins, and they can get a very detailed look at their heart arteries. And those scans require a lot of radiation exposure. However, for what we're doing and what we offer is no IV, no dye, and just the lowest level radiation exposure on one of these scans. And frankly, the amount of radiation they're getting now with these very sophisticated CAT scans is extremely low, and patients should not worry about it. Our whole process from start to finish, patients come in, they meet with one of our providers. We make sure that they fit the criteria. We then walk them over to the CAT scan. The CAT scan takes a few minutes, and they go home, and we call them within 24 hours of their results.
Wow.
And we tell their primary care physician 24 hours the results. And the one thing that we promised here at Excella that a lot of our other facilities in Western Pennsylvania don't do is we provide personal phone calls to the patients, because it's so scary to go get one of these CAT scans. You're worried if, oh my God, I have cancer, I smoked my whole life. And we don't want that to go on for weeks. We want to give them an answer. And the good news is this, and I tell patients, and our team tells patients, they have a 98% chance of having a clean CAT scan for their first CAT scan, despite smoking for all those years.
Mm-hmm.
And the other thing I tell them that's really important is it's not just getting one CAT scan and saying, oh, I'm clean, I don't need to worry. We invite you to come back annually for a repeat scan, because the whole purpose of lung cancer screening is to reduce the chance of dying from lung cancer. So we know that a percentage of patients, even if their first scan is clean, subsequent scans may show something. And those are the ones we attack, and we attack fast because they're early. They just grew up from a scan that was normal. So it's largely an early stage tumor, and one that we can treat very effectively. We have treatment now where we do lung cancer surgery. In the old days, people used to stay in the hospital for 2 weeks.
Yeah.
Many of our patients go home overnight having the same type of operation but performed minimally invasively using robotic technology. And these are people that are in their 80 years old. It was unheard of 20 years ago when I began doing this, that you could operate on someone, take a lobe of the lung out for cancer, and send them home the next day.
Right.
And tell them they could drive, and tell them they don't need narcotics. It's amazing how the technology has advanced in the right hands to offer people high-end care with a lot less invasiveness.
Now, somebody unfortunately would get the diagnosis of lung cancer, and what are their treatment options nowadays? You mentioned surgery. What else is there?
Well, the field of treatment for lung cancer is exploding. It is amazing, and we see a lot of patients, unfortunately, that by the time we start our evaluation or after the conclusion, we decide, unfortunately, they have advanced cancer. They have stage 4 cancer. There's 4 stages of cancer. Stage 1 and stage 2 are the earlier tumors that we think are curable with treatment. When it's spread to other parts of the body, we define that as advanced for stage 4. And in the past, the treatment for those patients was largely chemotherapy, which still works very good, and in select cases, radiation therapy, which can shrink tumors and control symptoms. But now we have all new weapons that are coming out and continue to come out. We use immune therapy, which is a way to boost the immune system to fight the cancer cells. And we've also learned about the genetics of the tumor, the blueprint, what caused the cancer, certain genes that cause cancer. We now know that we can interrupt the pathways that those genes control and halt the progression of cancer. So I tell patients, either way, we have many sophisticated options, one for early stage tumors and 2 for advanced stage tumors, that people can live longer and live better qualities of life than they could, 5 or 10 years ago. A lot of patients come to us and say, boy, my mother had cancer and she had a horrific experience with the treatment. And we tell them that the treatment is evolving. It's a lot different than it was, and it continues to get better, which is the hope that is important for people out there. Number one, we have to stop smoking in our society. We have to stop kids. But then we have to find these tumors and treat them. over 220,000 people get lung cancer a year, and about 160,000 die in the United States. People are living longer with cancer, with lung cancer, especially with some of these new disease strategies for treatment involving immune therapy and targeted therapy. So, we counsel people about this and really get them to feel comfortable with the process and the treatment options and let them know that there is hope.
Sounds like there is hope along the way. Now, getting back to the Advanced Lung Center at Excella, I'm looking at your website at excellahealth.org, and there's a page there about the Advanced Lung Center, which I'm sure people can search for on the website. But it says on the one side, do I qualify? And I'm assuming that's if they qualify for screening processes?
Correct. The screening is a national screening initiative, and in Europe, it's also there's a screening initiative. The criteria are a little different, but currently in the United States, Medicare has approved screening for people between the ages of 55 and 77 who have smoked the equivalent of a pack a day for 30 years or 2 packs a day for 15 years, and who are current or former smokers. Now, we go through the whole screening criteria with people. They're welcome to call in and say, this is my story. And the other thing that's important is that they don't have symptoms of lung cancer, because we're doing this as a screening to detect early stage lung cancer. People that have symptoms, we want to see them as well, but they'll go through a different process. If somebody calls and says, I've been coughing up blood, I want to be evaluated, we'll bring you in the next day and evaluate you, but the evaluation will be a little different. The bottom line is we're looking for people that are smokers or former smokers who don't have symptoms of lung cancer. And a lot of that should be on the website. But if it's not, call, you'll talk to a person and they'll tell you about the program. They'll tell you about insurance coverage, and they'll tell you about the whole process. It's a scary process, but I think when we built the program, and we've done now more than 7,000 scans, we wanted it to be very personal. And we wanted to be, that's why we give personal phone calls. And if somebody calls in, they're talking to a person, they're not talking to a computer.
And that's at excellahealth.org. What is the phone number to call if they don't have a computer?
Our main phone number here is area code 724-689-0520.
That is 724-689-0520 to get a hold of the Advanced Lung Center. Dr. Michael Szwerc, anything else you have to say before we close?
Yeah, I think this is very important, and this is going to change criteria in the next couple of years, in my judgment, but it's something that's really big out here. We see a lot of families that their parents had lung cancer, or 2 siblings, a brother had lung cancer, a sister had lung cancer. Cancer runs in families, lung cancer runs in families as well. So the 2 messages are, number 1, if your mother or father had lung cancer and your grandparents had lung cancer, please don't smoke, because you may have genetic predisposition to developing cancer. So you have to modify your risk factors. And number 2, encourage your children, especially if you're a smoker with cancer and you see your children smoke and you have a family line of smokers, to please encourage them to stop. And anybody that has any questions, especially if they have a family history of lung cancer and they're concerned, please call us, and we'd be happy to talk to you by phone. And in some cases, getting a CAT scan to make sure that you're clean and free of a disease makes sense. And we'd talk to you about that option. So I really encourage families to talk to each other and try to get the next generation to be tobacco-free, especially if there's cancer in that family.
Dr. Michael Szwerc, he is a thoracic surgeon and director of the Advanced Lung Center at Excella Health. Thank you for being with us today.
Well, thank you very much, and I really appreciated the opportunity.
If you would like to feature your event or organization on In Touch, send us an email to faywestmonradio@gmail.com. That's faywestmonradio@gmail.com. I'm Eric O'Brien, keeping you in touch with the community.
In Touch is a public affairs presentation of Broadcast Communications, Inc.